It all starts like something out of a medical thriller. The year is 1976. Hundreds of people at a big convention in Philadelphia suddenly get sick with this mysterious and really deadly pneumonia. Doctors are completely baffled, people are panicking, and this massive scientific manhunt kicks off. And that investigation? It would eventually give a name to this invisible killer, Legionnaires' disease.
So let's go back to the beginning. Let's start with that outbreak that gave the illness its now famous name, the medical mystery of 1976.
Okay, so picture this. It's July 1976. Members of the American Legion are all in Philadelphia for their annual convention. But by August, something terrifying starts to happen. Attendee after attendee is getting sick and, seriously sick. It took another 5 months, all the way until January of '77, for scientists working around the clock to finally corner the culprit, a bacteria that nobody had ever seen before.
And that discovery is, of course, how it got its name. As a way to honor that first group of patients, the American Legion members who went through that terrifying ordeal, the illness was officially called Legionnaires' disease.
So one mystery was solved, but it immediately opened up a new one. What exactly is this invisible culprit that can just hide in plain sight and make people so incredibly sick?
So at its core, Legionnaires' disease is a very serious lung infection, a specific kind of pneumonia. The cause, we now know, is a bacterium called Legionella. And, it's a natural bacteria, but when it finds just the right man-made environment, that's when it can become a really big problem.
And here's where it gets really interesting. This one bacteria, Legionella, can cause two totally different illnesses. On one hand, you've got the severe, potentially deadly Legionnaires' disease. But on the other hand, it can cause something called Pontiac fever, which is much more like a mild case of the flu that just goes away on its own. Same bacteria, two very different outcomes.
Okay, so this brings us to probably the most important question of all. If this bacteria lives in water, how in the world does it get from the water into our lungs to make us sick?
Right, and this is the key. You do not get sick from drinking contaminated water. It doesn't work that way. The infection only happens when that bacteria gets aerosolized, turned into a fine mist or vapor, and you breathe it in. The bacteria basically hitch a ride on these tiny water droplets and go straight into your lungs.
So where does this contaminated mist come from? Well, once you start looking, you realize we're surrounded by potential sources. The cooling towers on top of big buildings, the steam coming off a hot tub, even just the spray from your shower. It can even grow in your car's windshield washer tank if you just fill it with plain water. All of these are places where water can sit around and warm up, creating the perfect little incubator for this bacteria to grow.
Now, here is one piece of really good news. Unlike the flu or a common cold, you generally can't catch Legionnaires' disease from another person. It's an environmental exposure, not a contagious one, which is a huge relief.
Okay, so let's make this personal. Let's talk about knowing your own risk. Who is the most vulnerable here? And what are the warning signs you really need to be watching out for?
The symptoms can look a whole lot like other types of pneumonia. We're talking a cough, feeling short of breath, a high fever, muscle aches, headaches, all that nasty stuff. But the real clue is the timing. These signs usually pop up anywhere from 2 to 14 days after you've been exposed to the bacteria.
And here's another really critical point to remember. Just because you breathe in the bacteria, that doesn't mean you're definitely going to get sick. For a lot of people, their immune system just fights it off without a problem. Your personal health really plays a huge role.
So who really needs to be careful? Well, the risk goes up quite a bit for people over 50. Same goes for current or former smokers or anyone with a chronic lung disease like COPD. And of course, anyone with a weakened immune system, whether that's from an illness like cancer or diabetes or even certain medications, is also at a much higher risk.
All right, so we've covered the history, the culprit, and the risks. Let's get to the most important part. What can we actually do about it? How is it treated? And even better, how do we prevent it in the first place?
When it comes to diagnosis, it's usually a two-step process. First, a doctor will likely do a chest x-ray, and that'll confirm, yep, there's pneumonia here. But to know if it's specifically Legionnaires, they need to find the bacteria. And they usually do that with a simple urine test or by testing a sample of phlegm. And here is the fantastic news. Legionnaires' disease is absolutely treatable with standard antibiotics. But And this is a big but. The key phrase is when caught early. Getting that diagnosis and starting treatment right away is everything. It's crucial for a full recovery.
And the reason that early treatment part is so critical, well, this is why. The stakes are really high. Overall, about 1 in every 10 people who get Legionnaire's disease will die from it. That's a pretty sobering number, and it just shows why jumping on it fast is so important.
And if you think that's bad, the situation gets even more serious for people who are already vulnerable. For patients who get the infection while they're in a hospital or another healthcare facility where their immune systems are probably already weak, that number jumps to a shocking 1 in 4. A quarter of those cases are fatal. That just screams how vital good water management is in those places.
Okay, after seeing numbers like that, the natural question is, so what can I do? How can I protect myself? And the great news is, there are some pretty simple, practical steps you can take.
At home, it really just comes down to basic maintenance. First, make a habit of cleaning things like your shower heads and the little aerators on your faucets. That gets rid of the gunk where bacteria loves to hide. Second, if you have a guest shower or a sink you rarely use, just run it for a few minutes once a week. That keeps water from sitting there and getting stagnant. And third, a super easy car tip. Always use actual windshield washer fluid, not just water. It has detergents that stop bacteria from growing.
Now, while those individual actions really do help, the biggest impact comes from the top down. For big buildings, we're talking hotels, hospitals, offices, the single most effective way to prevent outbreaks is to have a solid water management program that is constantly testing and maintaining the entire system. That's how you stop Legionella before it even has a chance to grow.
And that really leaves us with the final thought to chew on. The story of Legionnaire's disease is this powerful reminder that our health is so deeply tied to these complex environments that we almost never see. The plumbing inside our walls, the air systems running over our heads. It really makes you wonder, doesn't it? What other hidden systems are out there, quietly shaping our health every single day?